So around a month ago, I covered Wes Streeting in his statement when he said he will open the NHS floodgates to privatisation. Well, we've got another doozy. Wes Streeting says NHS uses winter crisis as an excuse to ask for more money. Speaking on a visit to Singapore, Wes Streeting said the health service needs to accept money is tight and that it must rethink how the care it provides could provide better value for money for the taxpayer. I think the people working in the NHS and the patients using the NHS can see examples of waste and inefficiency, he told the Sunday Times. I don't think it's good enough that the NHS uses every winter crisis and every challenge it faces as an excuse to ask for more money. The NHS is going to have to get used to the fact that money is tight, and it's going to have to get used to switching spend and rethinking where and how care is delivered to deliver better outcomes for patients and value for taxpayers' money. I had to check initially if this was a Tory statement, but I realised a Tory wouldn't say this because they pretend they are funding the NHS. Obviously, they're not. But here's Streeting just coming out and saying it's not getting any more money. But let's talk about what he's saying in depth. Now, first, I think it's absolutely disgusting to say that the NHS is using winter as an excuse for more money. Every year is a winter crisis for the NHS. Therefore, more money needs to be put into it. That's not an excuse. That's asking for a solution. And who is he even referring to when he says the NHS? I mean, I feel like most likely he's talking about NHS workers. And doesn't that fill you with confidence that he's probably going to be the next health secretary? Now, he says the NHS needs to get used to the fact that money is tight. We are already used to that. We've had 13 years of chronic underfunding, and here Streeting is openly admitting that he will continue Tory policy of starving the NHS of funds. I despise this man so much. The only way to get better outcomes is for the government to put their hands in their pockets. Now, one of the biggest issues the NHS faces is a shortage of beds. How are we going to get more beds without spending money? Magic beans? Its infrastructure needs upgrading. The computers they use are just dog shit slow, which on the surface doesn't sound like a big deal, but it is a huge deal. How many times has a computer crashed in an NHS hospital? How many times have you been in a hospital and the receptionist has had to reset the computer? I mean, it literally happened to me the last time I went. That is time right there, plus data. For all the talk about skills shortages and vacancies, which are important, a basic upgrade, which is done by a cash injection, is desperately needed. Now, he also says there is waste and inefficiency, which is a line we hear from the Tories all of the time, but this argument is crap. In fact, No Justice sums it up in a tweet incredibly well. Public services, especially healthcare, are supposed to be redundant, not efficient. Lansley, etc. spent half a decade trying to find efficiency savings in the NHS, and there aren't any. Streeting hasn't got a clue, yet his followers bleat his uninformed nonsense uncritically. When you hear a politician talk about efficiency savings, it is not good. It essentially comes from the same school of thoughts that public services should be run like a business, always in profit and always on the lookout for saving money. That is a big fat no. Public services should never be run like a business. You should never look to cut corners. It is a service, not a profit-making machine. And that's not to say that we should spend money left, right, and centre for no reason, but rather the goal is to have a world-class service and not look to cut funding. Public debt is private wealth. In the private sector, the system is always skewed towards cutbacks and savings since the goal was profit. The state, however, it doesn't need to be this way. It's okay if services are ran at budget deficits, because if you have a well-run public service, that boosts the private sector. Now, if you're not following what I'm saying, I'll give you an example. A high-quality NHS creates a healthier nation, which means a more productive workforce to create more value in the private sector. Now, this simple logic is wholly rejected by the establishment and the grown-ups who think they understand how the economy works. Now, let's talk about the level of funding. If you ask the average person, they may well say, well, we put so much money into the NHS. The Tories would tell you they put record amounts of money in, and now Labour are saying we need to look for savings. But the facts say otherwise. So we spent 181.7 billion between 2022 and 23, which is actually less than the year before, which was around 200 billion. Now, for those from the IEA, or politicians generally, they look at the sum and go, wow, that is an ungodly amount of money. But this isn't the measure of how to fund the NHS. It's just a total figure. It gives you no information. Now, let's look at comparative funding. So on average, we spent 3.7% more year on year since its creation. Now, this is necessary due to an aging population, a growing population, things like that. If you don't increase spending, if you keep it the same every year, that's actually a cut in funding. Now, you can see that between 1950 and late 1990s, we were pretty close to that average 3.7% increase. All seems all right, I guess. Then we have 1997, and look at the level of funding. It shoots up. Now, I'm not going to give Labour huge credit here because of PFI, and given that it put us in loads of debt down the line, then in reality, did they really fund the NHS? I mean, if you said no, I don't think that's unreasonable, but clearly there was an initial cash injection, even if it was from the disastrous PFI. But what do we see afterwards? We see a slashing funding, which is way below the average 3.7%. Now, some years we see no increase in spending whatsoever, and as I explained, due to population growth, people living longer, if you're not spending more than the previous year, that's effectively a cut. So this is where we are. A poorly functioning NHS due to Tory austerity, yet we now have a Labour shadow health secretary pretty much openly admitting that they won't do anything about it. If you think the NHS will be in safe hands because it's going to be a Labour government, you may be in for a rude awakening.